Hi, my name's Casey. I'm a junior nursing major, and today I'm going to be talking about mental health globally. I'm going to cover a little about what mental health is, some key factors affecting mental health, how nurses can help with this, the impact of mental health, some barriers and effects, and more. Starting off with the basics, what is mental health? So, mental health can be defined as a state of well being and the ability to thrive. Mental health can easily be negatively influenced due to stress, trauma, mental disorders, and even relationships. Mental illness refers to many mental disorders that affect one's mood, actions, and thinking. Anxiety is the most common mental health disorder and affects over 300 million people globally, with a 28% increase due to the pandemic. Over 1 billion people worldwide live day to day with mental disorders. 1 in 7 individuals aged 10 to 19 experience a mental health challenge. Suicide is the third leading cause of death in this age group. Among other age groups, 1 in 8 people suffer from a mental health disorder. There are several types of mental illnesses. The first one I'm going to talk about is anxiety disorders. Anxiety symptoms can be feeling nervous, tense, restless, experiencing a rapid heart rate, and having physical signs like sweating and trembling. Other anxiety disorders can be OCD and panic disorders. Another mental illness is depression, bipolar disorders, and other mood disorders. Depression can be symptoms of persistent sadness, loss of interest in activities, and changes in sleep, appetite, or energy levels. Bipolar can be extreme mood swings between manic and depressive episodes. Then there is eating disorders. Eating disorders can be spending a lot of time worrying about your weight and your body shape, eating too little or binge eating, and then making yourself sick. There's psychotic disorders such as schizophrenia, and it can also be substance-induced. Schizophrenia can be hallucinations, seeing or hearing things that aren't there, delusions, false, unshakable beliefs, disorganized thinking and speech, and abnormal motor behavior. PTSD is post-traumatic stress disorder. Intrusive thoughts like nightmares and flashbacks, avoidance of reminders of the trauma, changes in thinking and mood such as negative thoughts and feelings of detachment, increased arousal and reactivity, including irritability and exaggerated startle responses. Then there's ADHD, which is inattentiveness, hyperactivity, and impulsivity. Globally, there is a wide variety of things that can affect mental health. One being poverty. This can cause stressors about housing, income, food insecurity. There's also education. Higher education is proven to have better mental health outcomes. Also, not enough being taught about mental health or how to manage it is a big issue within younger individuals. Another one is healthcare access. Those who do not have access to healthcare are left undiagnosed and untreated and have no resources. Another is brain chemistry, and this has a lot to do with mental disorders. Some people have an imbalance of neurotransmitters that do not work properly, and then they fail to send signals. Another is life experiences. Negative experiences tend to stick with a person and have long-lasting effects resulting in PTSD, stress, anxiety. And there's also stigma. Individuals fail to receive help with fear of being judged in many cases. One thing that leads to a decline in mental health symptoms is the lack of funding. Funding from the government is a big one. When federal and state governments cut funds, every level of mental health care gets squeezed. This includes hospitals, community clinics, school-based services, crisis centers, and outreach programs. Another one is insurances. When mental health is not prioritized by the government, private practices reimburse mental health services at lower rates. This then discourages providers from accepting insurances, making care less accessible. Some individuals' insurances will not cover things such as therapy. Another one is limited access. This includes long wait times, few providers, and entire communities without psychiatric services. A lot of psychiatric units are actually shutting down. Another one is reduced quality of care, overworked staff, high caseloads, limited time to spend with the patients, which means they're just squeezing patients in and out, which leaves no room for actual improvement. And lastly, worsening of mental health. People only get help once symptoms escalate, leading to worse outcomes. Many side effects can result from individuals suffering from untreated mental illness. One of these are declined function. This can be anywhere from school to the work environment. More advanced symptoms are harder to treat. People struggle with daily activities, concentration, school, work, and self-care. This can be even just getting out of bed in the morning. Another one is crisis. Those who suffer from mental illness have an increased suicidal thoughts or behaviors. This is a great risk of self-harm or unintentional harm. More psychiatric emergencies require hospitalization due to this. Another is family role strain. Caregivers experience burnout, financial stress, and emotional fatigue. Family conflict can also increase due to the misunderstanding of symptoms that an individual is feeling. Children in the home may also experience instability or trauma if they have a parent who suffers from mental illness. Another is homelessness. Untreated severe mental illness significantly increases the risks of homelessness. Individuals without treatment struggle to maintain housing and keep a steady income. Another is substance abuse. Many self-medicate with alcohol, opioids, or illicit drugs to cope. Illegal activities also occur with people who are left untreated and are more likely to be arrested for nonviolent behavior such as trespassing, disorderly conduct. Currently, jails and prisons have actually become a secondary psychiatric facility. Lastly is the reduced quality of life. This is social isolation, hopelessness, poor relationships, inability to reach personal education and career goals, which ultimately leads to a lower life expectancy. Some studies have shown 10 to 20 years lost for severe untreated conditions. There are many ways that mental health can be treated and health promotion can be enhanced. One of these are early intervention. Doing this, we can provide school-based mental health programs and screenings, community education campaigns to reduce the stigma upon mental health to make people more likely to get treated, and routine mental health checkups in primary care settings. Another one is easy accessibility. We can do this through teletherapy, which is just therapy on the phone, and digital mental health platforms that make it easy accessible. We can do peer groups, support groups, and community-based counseling, integration of mental health into primary health care to reduce costs. With advocacy, we can advocate for increased government funding and increased coverage of insurances. We can promote mental health policies that support workplace and school mental wellness programs so that it's introduced earlier on in life. Lastly, we can promote self-care. We can encourage regular sleep, exercise, and nutrition. We can also teach stress reducers such as social connection programs, mindfulness, meditation, and therapy.